Good morning. Today, we pause and remember the brave heroes that made the ultimate sacrifice on this day 19 years ago in New York City, in Washington, D.C., and right here in Pennsylvania. I would like all of us to observe a moment of silence in their memory. Thank you. Today, in addition to thanking all of those who served 19 years ago, I want to thank our first responders who are on the front lines right now of the worst pandemic that we have experienced in our lifetime. Without hesitation, our healthcare providers, emergency medical technicians, paramedics, advanced life support teams, National Guard members, firefighters, and police officers have once again answered the call to save lives. They have worked nonstop to save lives in our community, in hospitals, and in long-term care facilities. And they have spent time away from their families to keep them safe after treating COVID-19 patients. As we prepare for the fall and the winter, their work becomes more and more vital, and we all owe them a debt of gratitude. Just as our first responders are united in protecting us, Pennsylvanians must also be united in this fight to stop the spread of COVID-19. We need to be united in wearing masks when out in public. We need to be united in practicing social distancing. And we need to be united in adapting to protect our communities. We know that we all have a collective responsibility to stop the spread of COVID-19. So please adapt your activities to protect against COVID-19 and the flu. And as always, stay calm, stay alert, and stay safe. And now I'd like to introduce Pennsylvania's Fire Commissioner, Bruce Trager.
Thank you, Secretary Levine, and thank you for the opportunity to speak to you folks here today regarding this day and our responders. First responders remain integral in providing assistance to those going through some of the worst experience they have ever had to deal with. Unfortunately, we learned very early on in the pandemic response that our line of work creates unique and frequent exposure risks, including COVID-19. While this year has brought many challenges, our colleagues have answered them with perseverance, teamwork, new ideas, flexibility, and most importantly, with the steadfast dedication to serving those in need. I see this dedication every single day, but today is different. 19 years ago, on September 11th, 2001, we all watched as countless fire service, police, emergency medical services, Port Authority, and indeed many others rushed into the Twin Towers with a singular purpose: to save lives. They were not alone in Manhattan that day, as the brave men and women on Flight 93 rushed the cockpit and federal employees and soldiers worked alongside each other to get people to safety at the Pentagon. The world we knew it changed right before our eyes. We must not forget our heroes, and likewise, we must live by their selfless examples. They didn't think of their personal safety that day. They just wanted to help. And afterwards, as we walked through our neighbors in the following weeks, it became apparent that the fact is one of the things that united us as a country. Looking back, we need to take a moment for those who are gone, as well as appreciate those who are still with us. some of whom are still serving as first responders. While we are familiar with the men, women, and service animals that lost their lives that day, many walked away from the rubble with deep wounds, both physical and mental. I'd like to take a few minutes to talk about the invisible injuries too many first responders suffer from. The numbers of first responder suicides is alarming and is increasing. Please think about this one statistic for just a moment. In 2017, there were more suicides among fire service personnel than there were line of duty deaths. As of the end of August, there were already 60 confirmed suicides of first responders. And we know that these statistics like these are important catalysts for action. Recently, the Wolf administration, members of the General Assembly, and Prevent Suicide Pennsylvania recognized World Suicide Prevention Day, which was yesterday, the 10th. Also, National Suicide Prevention Month, and went on to release Pennsylvania's statewide suicide prevention plan. This plan was developed by the State Suicide Prevention Task Force. It is a 4-year strategy to reduce suicide in Pennsylvania by fighting the stigmas that are associated with mental and behavioral health, increasing training and education on suicide and mental health. Of the 8 goals, goal number 1 of the plan is to increase suicide prevention awareness, efforts that reduce stigma and promote safety, promote help seeking and wellness. As part of the Office of the State Fire Commissioner's commitment to this cause, we recently announced the availability of 4 online courses at no cost to Pennsylvania Fire and Emergency Medical Services personnel through the online training portal Train PA. If you're not already registered, users will be required to register to the Train PA account. The courses cover a variety of topics and are entitled Being a First Responder During a Global Pandemic, Had a Bad Call, How to Better Support Your Fellow First Responders, and Capturing the Load. The first 3 courses average 10 minutes each. Capturing the Load is a 1-hour program. In closing, I would like to thank Governor Wolf, Secretary Levine, and all those who assisted in the development of the statewide suicide prevention plan. We must continue their leadership and their efforts to support all first responders. Last and not least, I want to reiterate the somber occasion that calls us together today. With so much happening in our country today, we have to remember the lessons we learned 19 years ago when Sandy Dahl, still mourning the loss of her husband on Flight 93, said, "If we learned nothing from this tragedy, we must learn that life is short and there is no time for hate." Never forget, and thank you.
And now we're pleased to answer questions.
Dr. Levine, thank you. Dr. Levine, there was a football game last night in Kansas City. There were fans in the stands. I forgot the percentage. I forgot what Arrowhead Stadium holds. But I know right now, I guess the plan, at least in Pittsburgh and Philadelphia, is to not have fans in the stands. Can you talk about the difference, if any, between maybe the safety measures they're taking in Kansas City versus Pennsylvania? And do you foresee fans ever in the stands in our NFL cities here in Pennsylvania?
So you are correct. Because of our mitigation efforts to prevent the spread of COVID-19, there will not be fans for the Pittsburgh Steelers home games and the Philadelphia Eagles home games. Different states have different guidelines and different rules, so I cannot speak to Missouri's guidelines and rules, but the governor strongly feels, and I strongly recommend, that we do not put people at risk in terms of putting them together in congregate settings, and so we have a 250-person outdoor limit, and so there'll be no fans. It's impossible for me to predict the future, so we'll see.
I mean, and predicting the future, I know, is so tough, but are there some factors that maybe would, you and the governor would maybe revisit that? I mean, what would have to be in play for you
Sure.
and the governor to maybe revisit that decision?
Well, we would need to see a substantial reduction in terms of the amount of community spread in Pennsylvania to consider changing the outdoor guidance. So things change, of course, in the future. We're hoping for a vaccine and other measures. So things change. But at this time, given current circumstances, we feel it is in the public's best interest not to have fans for those football games. Other questions?
Just
Yes.
to clarify, before, I believe, is that new guidance? Because I thought the Steelers said no fans for the first 2 home games.
I don't know exactly what the Steelers said. We are very pleased to engage with the Steelers and the Eagles at any time and have discussions, but we have no plans at this time to have fans come.
You talked about we can't predict the future, and you've been a straight shooter since day one. What factors need to be in play to really change the trajectory of this pandemic? I mean, does it really come down to having a vaccine and improving treatments in addition to us? You used the words that we all have to be united.
Sure.
I mean, are all these factors kind of have to be in play to really change this thing?
Sure.
To even, dare I say, get rid of this pandemic?
Unfortunately, it's not something we can just get rid of. I mean, the virus is here. It's very contagious, and it impacts all ages. It impacts all demographic groups, and we are all vulnerable. And there are some of us that are particularly vulnerable, seniors, particularly those in congregate settings, such as long-term care living facilities. But then other groups, particularly minority groups, are very vulnerable in terms of the impact of COVID-19. I mean, what this global pandemic has certainly taught us, what COVID-19 has certainly taught us, is how interconnected we all are. We are literally, not just philosophically, we are literally all in this together. And so that is why we're talking over and over again about being united. What I do impacts the community, not as Secretary of Health, but as an individual in the community. What you do impacts the community. And that is why it's so important to be united. There are some absolute concrete things that we all can do that will impact the spread of COVID-19, and we talk about them every day. It has been seen over and over again that the simple act of wearing a mask in public, whether you're indoors or outdoors, will impact the spread of COVID-19. The University of Washington model that the White House has talked about a lot, it has several different, you go on it, it has several different trajectories of COVID-19 in the United States and throughout the world and in each state. And one of them is if there's universal masking, and there will be less cases and less deaths in the United States if we have universal masking and everybody takes the simple but powerful step to wear a mask. If there is no masking, then it goes up dramatically. If we're following the same trend, it's kind of in the middle. And so by social distancing, by washing our hands, by using hand sanitizer, and by wearing a mask, each one of us can impact the spread of this virus and its impact on ourselves, on our families, and on our communities. In addition, there have been targeted mitigation factors that we have taken when necessary to prevent the spread. And of course, the development of a vaccine is absolutely critical, a safe and effective vaccine, and then its distribution and administration. And I think that that's how the United States and each state will working together collectively be able to stop the spread of this virus.
Schools have been in session now for a couple weeks. How, from the Department of Health standpoint, how are things going overall statewide with that? We've seen schools in the area have to close for a couple days because of cases. And just from your perspective, how are things going in schools?
Well, we are working very closely at the Pennsylvania Department of Health with the Pennsylvania Department of Education and working with superintendents and school boards and other school authorities to do whatever we can to protect students and faculty and staff, to protect the teachers and the staff, but perform the critical, the absolute essential activity of teaching young people. Where we've seen the biggest increases are in colleges and universities. So we have seen significant increases in terms of the 19 to 24 age group. And so as we have seen some up and down, but some increases in terms of our case counts impacted by the holiday a bit, then it has been in 19 and 24-year-olds throughout the state where those increases have been, predominantly in college and university settings, although not exclusively. Of course, those colleges and universities are all in communities, and they are in counties, and they impact those communities and counties in terms of the spread of this virus. And so, you know, the Pennsylvania Department of Education and Department of Health have been in contact with colleges and universities. We're very pleased to work with them to do whatever we can to help contain and then mitigate the spread of this virus.
Does that suggest that maybe the 19 through 24-year-olds in the college and universities may not be doing what they're supposed to do to stay safe?
Well, we have seen that. So we have seen some young people that are congregating at parties or other types of activities and not necessarily wearing a mask, not practicing social distancing, not washing their hands, and that is contributing to that spread. And so I know that the colleges and universities are working with their students in terms of all of that and emphasizing the same things that I emphasize every day. Some have gone to online learning. Some have blended learning, but it's not just in the classroom. It's outside activities that are really important. And so we want to work with the young people. We want to work with college and universities. We want to empower the young people. You just can't talk at them. You know, my field is adolescent and young adult medicine. You have to work with the young people and empower them to make the right decisions. And so that's what we're going to work to do. Yeah.
And then as we see the daily positivity rate go up and down, has there been any discussion on what the positivity rate could be to increase certain capacity limits? When I know we're increasing the restaurant capacity to 50 later this month, but other, indoor events, outdoor events to increase those capacity limits?
Well, we would need to see consistent decreases in order to do that. So that is not what we've seen. I mean, we've seen some decreases about 2 weeks ago. We saw some increases last week. This week has been up and down. I think that that's impacted by the holiday. We need to see the impact 2 weeks after the holiday to see if certain activities during the holiday increased our case counts. And of course, we are impacted by what happens in other states. The biggest areas of the United States that are impacted now are actually in the Midwest. North and South Dakota, Nebraska, Iowa has been very impacted. Indiana, Illinois, Ohio has been impacted. And so we know from what happened this summer is that, again, we are all literally connected and in terms of Pennsylvania and other parts of the country. So we'll have to see what those increases mean for Pennsylvania as well. So we're going to be all tracking that, of course, very closely. All right. Well, thank you very much. Thank you.